What are the signs of Alzheimer's disease? The symptoms of Alzheimer's can vary from one person to another. Memory problems are typically one of the first signs of the disease. Decline in non-memory aspects of cognition, such as finding the right word, trouble understanding visual images and spatial relationships, and impaired reasoning or judgment, may also signal the early stages of Alzheimer's. As the disease progresses, symptoms become more severe and include increased confusion and behavior changes. For most people with Alzheimer's, those who have the late-onset variety, symptoms first appear in their mid-60s or later. When the disease develops before age 65, it's considered early-onset Alzheimer's, which can begin as early as a person's 30s, although this is rare. Alzheimer's typically progresses clinically in several stages: preclinical, mild, sometimes called early stage; moderate and severe, sometimes called late stage. Preclinical Alzheimer's disease research suggests that the complex brain changes associated with Alzheimer's, such as the formation of amyloid plaques or tau tangles, start a decade or more before memory and thinking problems appear. This stage, in which changes in the brain appear before the onset of dementia, is called preclinical Alzheimer's. However, it's important to note that not everyone with these brain changes develops dementia. Signs of mild Alzheimer's disease. In mild Alzheimer's, a person may seem healthy but has more and more trouble making sense of the world around them. The realization that something is wrong often comes gradually to the person and their family. Problems can include memory loss that disrupts daily life, poor judgment, leading to bad decisions, loss of spontaneity and sense of initiative, losing track of dates or knowing current location, taking longer to complete normal daily tasks, repeating questions or forgetting recently learned information, trouble handling money and paying bills, challenges in planning or solving problems, wandering and getting lost, losing things or misplacing them in odd places, difficulty completing tasks such as bathing, mood and personality changes, increased anxiety and/or aggression. Alzheimer's is often diagnosed at this stage. Signs of moderate Alzheimer's disease. In this stage, more intensive supervision and care become necessary. These changes and increasing needs can be difficult for many spouses and families. Symptoms may include: read and share this infographic to learn about how to tell the difference between age-related forgetfulness and dementia. Increased confusion and memory loss, such as forgetting events or personal history. Withdrawal from social activities. Inability to learn new things. Difficulty with language and problems with reading, writing, and working with numbers. Difficulty organizing thoughts and thinking logically. Shortened attention span. Problems coping with new situations. Changes in sleeping patterns, such as sleeping more during the day and being restless at night. Difficulty carrying out familiar multi-step tasks, such as getting dressed. Occasional problems recognizing family and friends. Hallucinations, delusions, and paranoia. Impulsive behavior such as undressing at inappropriate times or places, or using vulgar language. Inappropriate emotional outbursts. Restlessness, agitation, anxiety, tearfulness, wandering, especially in the late afternoon or evening. Repetitive statements or movement, occasional muscle twitches. Signs of severe Alzheimer's disease. People with severe Alzheimer's cannot communicate and are completely dependent on others for their care. Near the end of life, the person may be in bed most or all of the time as their body shuts down. Symptoms often include inability to communicate, no awareness of recent experiences or surroundings, weight loss with little interest in eating, seizures, general physical decline including dental, skin, and foot problems, difficulty swallowing, groaning, moaning, or grunting, increased sleeping, loss of bowel and bladder control. A common cause of death for people with Alzheimer's is aspiration pneumonia. This type of pneumonia develops when a person cannot swallow properly and takes food or liquids into the lungs instead of air. While there is currently no cure for Alzheimer's, there are medicines approved by the U.S. Food and Drug Administration that may help treat the disease. There are also changes that can be made to the home environment and daily activities to help a person manage their changes in thinking. Aging and Alzheimer's risk. Genetics of Alzheimer's disease, health, environmental, and lifestyle factors that may contribute to Alzheimer's disease. Scientists don't yet fully understand what causes Alzheimer's disease in most people. The causes probably include a combination of age-related changes in the brain, along with genetic, environmental, and lifestyle factors. The importance of any one of these factors in increasing or decreasing the risk of Alzheimer's disease may differ from person to person. Alzheimer's disease is a progressive brain disease. It is characterized by changes in the brain, including amyloid plaques and neurofibrillary, or tau tangles, that result in loss of neurons and their connections. These and other changes affect a person's ability to remember and think, and eventually to live independently. Aging and Alzheimer's risk. Older age does not cause Alzheimer's, but it is the most important known risk factor for the disease. The number of people with Alzheimer's disease doubles about every 5 years beyond age 65. About 1/3 of all people age 85 and older may have Alzheimer's disease. Scientists are learning how age-related changes in the brain may harm neurons and affect other types of brain cells to contribute to Alzheimer's damage. These age-related changes include atrophy, shrinking, of certain parts of the brain, inflammation, vascular damage, production of unstable molecules called free radicals, and breakdown of energy production within cells.